The outbreak of Ebola in Uganda has seen the countries neighboring it raise their guards and ensure that all precautions are being taken. In Kenya, the Ministry of Health, which announced that 20 counties are at risk of reporting a case, says they are prepared for the eventuality of an Ebola case in the country. However, the Kenya Medical Practitioners, Pharmacist and Dentist Union KMPDU National Executive Council has dismissed claims by the Ministry of Health that the country is prepared to handle Ebola.
We are at a time that we have seen a strain of Sudan virus that is in Uganda that is much different from the previous ones. It spread fast. The number of 31 cases have been confirmed, and this is a moving target because statistics change every day. We also have 6 confirmed deaths which are directly related to this Ebola virus. The other more cases that are also being seen. The fatality of Ebola virus is averagely 50%, but these fatality cases can go up to 90% in some cases.
Should cases be registered in the country? Speaking during a press conference here in the capital, the union cited the example of the suspected case reported in Busia on Friday, saying the delay in releasing the test results shows a lack of preparedness.
And therefore there's value to have a vibrant, robust and resilient public healthcare system that in case we have a case in the country, we will be sure that it can be contained and we can act to it. We need to have a response team, surveillance and effective case management, that if a case occurs in any of our borders, then there would be a scare to have many healthcare workers having been exposed before results come in. It should be able to be identified, contained and managed. And this can only happen if there's a deliberate action from both the county governments that border these regions.
The union officials also called for the equipping of hospitals with PPEs and training of healthcare workers. They also said there is a need to more awareness among members of the public.
Create containment measures and to prevent occurrence of a disease in a country, or to prepare for it as if it's going to happen and then it fails to come, than eating the country when we are unprepared, because then it will be a reactionary process which will have more fatalities than expected.
Kenya has 14 beds for 100,000 people. Whatever you saw as a razzmatazz towards the COVID, or whatever that was, creating pseudo ICU spaces and not equipping them with personnel, those are white elephants that were meant to give kickbacks. There were 10%ers kickbacks. None of those structures exist now. Yes. And the healthcare system is supposed to be a continuum, right? That even as we are telling the country to prepare for it, just like we said at that time, we are also for the welfare of our members, and it's not lost to us that you're keen to oversight.
In neighboring Uganda, the first doctor and the second health worker died of Ebola on Saturday.